All right, welcome to the Homes Committee of Management. It is June the 25th, 2024. It is 10:49 a.m. and I will call this meeting to order. First order of business is the approval of the agenda.
Resolved that the agenda for the June 25th, 2024 Homes Committee of Management meeting be approved as presented.
Do we have a mover and seconder for that? If I get this right, Committee Member Jones and Committee Member Sloan. All in favor? That's carried. Adoption of the minutes? We don't have any. Brings us to reminding everyone of disclosure of pecuniary interest and the general nature thereof. I don't believe we have any. No delegations. Brings us to section 6, reports and briefings. 6.1, Director of Homes and Senior Services, Homes Committee of Management, Long-Term Care Director's Update, January 1st to March 31st, 2024. Good morning, Michelle.
Morning, Mr. Warden, and through you to members of the Committee of Management. I'll get that correct. So before you is a report that provides an overview of recent updates and Ontario Health and Ministry of Long-Term Care announcements, all of which impact our 3 county of long-term care homes. And so if you just follow along in the report, I'll highlight some of the areas that I think would be maybe interesting or worth a little bit of additional information. So on January 15th, 2024, there was a news release regarding the launch of Ontario's new 10-person long-term care investigation unit. The unit is, the investigators are designated as provincial offenses officers under the Provincial Offences Act. And I've outlined the areas that they will tend to focus on for that particular 10-person unit. The ministry invested $72.3 million to support this unit, and the 10 inspectors have been provided with 19 weeks of training, which does include investigative techniques, interviewing, search warrants, report writing, and court procedures. This new team is in addition to other measures that have been introduced by the ministry in the last couple of years. Most notably, the doubling of the number of inspectors. So there is now 1 inspector for every 2 homes across the province, and the introduction of new compliance and enforcement tools such as the administrative monetary penalties and the re-inspection fees. So with the increased number of inspectors, we are certainly seeing an increased number of inspections in our homes. The next, on January 22nd, there was a release of a memo just reminding us of our obligations for our staffing report and our workplace data collection for 2022. And that work was completed with collaboration from the finance and the HR departments. On January 31st, there was a good news story release. We received an announcement that the PREP funding, which is the Preceptor Resource and Education Program for long-term care homes, was going to be extended for another year. So this is funding that we can utilize at the homes level to support onboarding clinical placements in our homes. So we can backfill staff, we can do some extra orientation and mentorship with the individuals coming into our homes. And so all 3 of our homes have been approved for that funding. It is something that you have to apply for annually. On February 9th, there was communication regarding proposed amendments to the Ontario Regulation 246/22 under the Fixing Long-Term Care Act. I've outlined the staffing changes there for you. They're really minor changes with little to no impact at our homes level for our particular homes. And the Pandemic Recovery and Stabilization, the proposal would also require that the home's resident council and family council be involved when we make changes to visitor policies. But that's a practice we've been having at our homes since COVID came to our homes, and just wanting to make sure everyone was clear on what those changes and best practice recommendations were. And then an air conditioning clarification. So if a resident, one area that's highlighted here is a resident that may not want air conditioning. With the old regulations, we had trouble actually turning that off. And so with a lot of advocacy on our end, they've now recognized that if we care plan for that, that is an area that we can certainly make that adjustment for resident comfort. On February 12th, this is an important area that I just wanted to focus on. There was a release of a memo reminding long-term care homes of their obligations related to quality improvement and resident family satisfaction surveys. I'm highlighting this because our homes received, you'll see in my next report, some findings related to quality. and the surveys, and we're not alone in that. So it was significant enough across the homes where the province did send out a communication reminding homes of very specific obligations within those sections of the act. So all three homes are doing resident and family satisfaction surveys. They go out in the fall of each year, and then we receive the results in December, and those results are brought to the CQI table and the resident family councils and the departmental team so that we can incorporate changes and opportunities into our quality improvement plans. You'll see that I've included the annual reports for each of our homes, as well as our quality improvement plans. The quality improvement plans consists of a progress report, so reporting on the prior year, and our success or our opportunities and changes that we implemented and whether they were successful or not. And then our narrative report, so changes within our homes, and our work plan report. You will note if you've looked at those, had an opportunity to review any of those, that you'll see there's a lot of consistency in our plans across the three homes. We do have one quality improvement coordinator that works across our three homes supporting this work. And we do want to ensure that we're consistent in our processes and our policies and procedures, but still identifying those unique opportunities for each of those processes. It might look a little bit different at the homes. We also, just a reminder for this committee that we do have we are RNAO Best Practice Spotlight Organization designation. And so Terry Benwell, who's the administrator at two of our homes, leads this work and she collaborates closely with RNAO's long-term care best practice implementation coach, who the warden had an opportunity to meet recently, our new onboarding individual from our RNAO. And Terry has had the opportunity to support other organizations with onboarding. And so she is seen as a resource to other homes, other long-term care homes. On March 4th of 2024, we received some communication from the province indicating they've been analyzing the data with outbreaks and the COVID data. And so there was a recommendation, or actually not a recommendation, a requirement that we're ending the enhanced masking measures effective March 4th, 2024. That information was taken to resident and family council to make them aware, and policy work is there's always changes in that regard. So we were always looking at those specific policies. We still wear masks when we're in an outbreak, and we still require staff before entering a resident room to provide care and services, to do what's called a point of care risk assessment to see whether they need to put on a mask or other PPE. And then there's return to work protocols. So used to be when staff were off that had COVID, they had to stay off those full 10 days. So there's new guidance that allows at a certain point when your symptoms are lessening to be able to return to the workplace wearing a mask. So there's still times where we're wearing masks within the homes. And so we do have infection prevention and control managers at each of our homes. And so they're a big part of collaborating and planning for these changes and implementing them across our homes. We had a funding announcement. It's not included here, but it'll be in the next report on Friday last week, just indicating that the infection prevention and control funding that we've been receiving is going to continue for an additional year. So that's, or actually 2 years. So that's a good news stories for us, and we'll be able to continue to build our infection prevention and control programs in our homes. The next area, March 27th, 2024, there was a memo released in regards to supplemental construction funding subsidy for 2024. This is for eligible operators to support the cost of developing or redeveloping long-term care beds. It's up to an additional $35 per bed per day for 25 years for eligible projects. The catch here is that operators who can demonstrate, you need to be able to demonstrate readiness to start construction and obtain the ministry's approval to construct by November 30th of 2024. We've had conversations in this regard for Terrace Lodge in the past, and so Terrace Lodge doesn't qualify. But there may be opportunities for Alton County. And so in discussions with the Director of Finance and the CEO, I will be bringing a report to Council to provide Council with additional and specific details of this funding and to obtain any direction or guidance that you may have on potential opportunities for the homes regarding this announcement. The next area of my report is the reporting obligations that are done either by myself, the administrators of the homes, or the CAO under the delegation of authority bylaw. So for the period of January 1 to March 31st, I've highlighted the reporting that's been completed during that time frame. There's some good news stories in here, again, around funding. And I'll just be building on those as we work through the documents today. The one I did want to spend a bit of time on is Schedule F, Form of Compliance Declaration for Beauvier Villa and Terrace Lodge, our adult day programs. There is a requirement to submit this form by June 30th of 2024. And this is part of our multi-sector service accountability agreement, so our MSA. And it's the period of April 1, 2023 to March 31st, 2024. So basically, it's a form declaring that we've met our obligations locally and regionally for this program. And so to the best of my knowledge, we have met those obligations with one exception. And so that one exception is in regards to training and a work plan for Indigenous and equity, inclusivity, diversity, and anti-racism. The reason we haven't met that obligation is because there was not, from my perspective, the instructions were not fully clear to myself and our team and to other homes across the province. In prior years, it was the obligation of one person to be trained. And now there's a much greater expectation of the entire team, including members of the executive leadership team as well. So, and others for both the LSA and the MSA. So I would like to just submit identifying that that work will be completed by December 31st, 2024. And I suspect I'm not alone as in regards to this submission. So as one of the recommendations, Catherine will be reading a recommendation in regards to committee and management direction on that piece. I've also highlighted the agreements that have been executed during this time frame. And so again, all of the agreements follow the delegation of authority bylaw requirements, including review of the agreements by the legal team prior to execution. And each of them that require funding are funded either through some ministry related funding or were included, for example, the operational consultant was included within the Terrace Lodge redevelopment project budget. I will note that I have a typo in the third bullet point there. I inadvertently put the incorrect provider. It should be Westminster Mobile Imaging. That's providing our mobile imaging services for X-ray, Doppler, and ultrasound. Again, that's another example. There's no cost to the homes. That's all funded through OHIP, and there's no monies exchanged there. Project updates. I'm really pleased to report to this committee that staff schedule care, the work that we're doing, we're making significant progress. We've had the support of finance and human resources as we were sort of building the software behind the scenes, but we're now fully integrated for payroll, vacation, and other purposes. As well, we're now, the administrative clerks are utilizing the autofill feature when they're creating schedules. There's still some manipulation and fine tuning, but it's a significant time saving. And we're utilizing the Wizard, which is a phone call system for call-ins. But we're now, I'll be sharing in the next report, but mass messaging has been fully implemented across the homes. And again, a significant time saver. It's supporting in reduction of overtime costs and ensuring that we have people more readily available for shift replacement. So some of the benefits for frontline staff are they're able to see their schedules and their time cards and their time bank balances, their time off requests. They were able to submit on their app on their devices and shift exchanges and their vacation planner. So sign off for the first part of that project has been completed. We also transitioned to a new pharmacy during this time frame. And so Advantage Care Pharmacy did extensive training for registered staff and managers and physicians and to support that successful onboarding in January and February. And we're pretty excited because we're going to be moving toward what's called pharmacy-led medication reconciliation. And I know the physicians are eager to have this piece implemented across their homes. Again, just the mobile imaging and we were having challenges and across the province with getting ultrasound services on site. And so residents were having to go arrange transportation and go externally. And so this provider is able to provide ultrasound services for us on site. So that's a really good benefit for the residents of our homes. The next section of the report is the financial implications. So I've highlighted a number of announcements that have come through from the ministry. And the homes are really appreciative of each of these. So on January 8th, there was some diagnostic equipment funding that we had applied for in 2023, and we received communication in January that we were successful in some Dopplers and IV pumps for our homes and the associated costs for training of staff for that equipment. And so that will support residents with more complex needs at our home level versus sending residents off to hospital. It should reduce emergency room admissions and transfers. On February 21st, there was a communication from the ministry. Really, it's highlighting previous communications, but it's reinforcing the commitment. So at this point, for our direct hours of care, for that's PSWs, RNs, and RPNs, we are to be at 3 hours and 42 minutes of direct care for each resident by March 31st of this year, and we did achieve that goal. And then we have the 4 hours mandated for March 31st of 2025. And then the target for allied health professionals, which includes PT, occupational therapy, physiotherapy, social worker, dietitian, and a large number of other providers. The target there is 36 minutes. And so we've met that as well. There's a number of funding announcements here. And so my approach and discussion with the Director of Finance and our CEO is really because these are memos and we haven't gotten all of the information yet. So when we get the full information for each of these items, we'll be doing an analysis with the Finance Department and bringing a report forward to share additional information for these. So I just wanted to point that out. We also received some in-year reallocation of funds for the Adult Day program. So we did a submission and we were successful in receiving some funding, and those items have been outlined in the report for you, explaining the areas of improvement for the homes. Another really good news story is the March 19th, 2024 communication. So there's a funding from the ministry that's called Resident Health and Wellbeing for long-term care homes, and it's to support social services provided by registered social workers. Does include other allied health professionals. To date, we've tried to do RFPs and haven't been successful in our responses for social worker services. So we did it again. And so in the next report to council, you'll see that we were successful and we'll be introducing social worker services across the homes. The funding is $7.39 per bed per month, which doesn't add up to a big total, but it's actually in addition to the allied health professional funding. So working with finance, we've been able to introduce some opportunity there for social worker across our homes. Another really great opportunity or announcement on March 27th and March 28th, the ministry announced increase to our level of care funding envelope of 6.6%. In my time as a manager, that's the highest increase that I've seen for the level of care funding. So that was a very good news story. Again, full details not included in this memo, so coming for future reports. The staffing supplement, 4 hours of care. I've outlined the dollar amounts for each of these fundings. It's not new money. It's the same money. It's just a reassurance that this money is continuing, which is important for us to have that information. And on March 27th, we also received a communication in regards to a one-time increase to the long-term care home funding. It's a one-time per bed, $2,543 per bed, to help relieve financial pressure for long-term care homes and address some key priorities. So homes that are not compliant with the Ontario Fire Code regulations are required to use the money for that purpose. We are compliant across our 3 homes. And some other eligible expenditures would be deferred maintenance, bed development, staffing, other accommodation and level of care funding. Basically, any purpose that the homes are struggling with, the funding could be applied to those areas. Unused funding would be kept by the homes or the licensee. However, we are required to report quarterly until all of the money is utilized. So again, we'll be doing some analysis on our end and bring those recommendations of how that money is being utilized in an upcoming report. I was required to submit an attestation to Ontario Health West attesting to confirming the understanding of the use, the reporting, and the auditing of these funds. And so from our perspective, the announcements from the ministry and Ontario Health do support the quality of care and support positive outcomes at our 3 homes as we provide care and services to the residents of our homes and community clients through the Adult Day program. And the long-term care homes management team continues to be very thankful and appreciative for the support from council and the CEO and the entire staff across the corporation. And so there's 2 recommendations before the committee that Catherine will read, and then I'm happy to take any questions you may have.
Thank you, Michelle, for that report. And this is just from January to the end of March. Wow. Oh, several questions. Deputy Warden Jones?
Thank you, Mr. Warden, through you to Michelle. So I know inspections in the past take a lot of staff time, usually a couple of members of staff. But have you seen a significant increase in the workload with the new inspectors being implemented? Is it getting to the point where no one has time to do it all?
Thank you for that great question through the warden to yourself. So yes, they are on site more frequently, and it does, in my next report, I think I explained that they could be there for 1 day for up to 2 weeks. And so there is certainly a significant increase in the volume of workload, and most of the inspectors are very flexible in if we're having a very busy day to say, you know, I can't get that to you today, but I can definitely get that information for you tomorrow. But yes, we are seeing an impact, and then just the inspection reports do create some follow-up work on our end, actually starts when they're there because we can identify some areas where there's opportunity for improvement. But yeah, we're seeing more frequent inspections, and that does have an impact on the management team as a whole. Thank you.
Okay. Councillor Cook?
Thank you, Mr. Warden. Committee member Jones asked one of my questions. I have a comment and another question. First of all, wow, a lot of stuff happened in those 3 months. You have a lot of memos and requirements. I wonder if the ministry can say micromanagement. Second, the question I have is point click care, which is a new digital, I guess, service. What exactly does it do?
Thank you for those great questions, and through you, Mr. Warden, to Councillor Cook. So there is a lot of reporting requirements, and I have the fortunate ability to be a board member of Advantage Ontario. And so the reporting piece is something that we do have a lot of discussions about, and there are conversations with the ministry. There seems to be some duplication, and so there's opportunities. They're always looking at ways to lessen that reporting, but it is workload for both the finance department and the homes management team, myself, and even legal, looking at some of these documents before we send them off. So good to get the money, but it always creates a work and responsibility and accountability as well. Point Click Care is our software for electronic documentation. So all of our care plans, our progress notes, our assessments, everything is found within the Point Click Care documentation system. The piece that I think you might have been looking at here was eConnect. So this is, I've been working with Clinical Connect and the ministry and Ontario Health and Point Click Care to set up the training, and Blaine knows there's been a lot to this, as well as Nick been involved in the process. It's been going on a year to get everything set up for this eConnect, but we're doing the training now, and our registered staff, our managers, and a certain number of managers that would need access will have access to personal health information for our residents only. So I made the distinctive choice to go through Point Click Care to limit that access only to our residents of our homes. So our access is through Point Click Care versus going on a website and potentially having access to individuals outside of our 3 homes. So the training is ongoing. It's going to be a wonderful tool to support transitions in care, medication reconciliation. So we're excited about the opportunity. It's been a little bit getting there, but we're very close now. Hopefully I answered your question.
Councillor Cogan.
Supplementary, so does Point Click Care, is it connected to doctors and who service the homes?
Through eConnect that our frontline staff will have as well. Great question.
Any further questions? Yes, Councillor, Committee Member Jiguer.
Thank you, Mr. Chair. Not so much a question, but I was glad to hear that a specific financial report will be upcoming, because as we discussed during the council meeting, trying to assess our financial position and having up-to-date information will be really important. So as you pointed out, there have been so many announcements. And I know that in the past, there are many times where the announcements and the top-ups, so to speak, from the province were actually funding something that we had already planned. It was already within our standards, and we had already budgeted for that. So I could see how potentially this could have a positive impact on our overall financial position, and I think it will be critical to have an actual financial report related to the homes and the impact on our this year's budget, because I understand a lot of these announcements are one-time, which makes it difficult to plan long-term, but at least we should know what the impact is for this year's budget. Thank you.
Okay, thank you for that. Any additional comments, questions? Committee Member Widner.
Yes, thank you, Mr. Chair, through you to Michelle. Michelle, you alluded to the fact $72 million, we have 10 inspectors, like, what are we getting for the rest of our money? I mean, I'm confused. Thank you.
Thank you for that question. I don't know that I can truly respond or comment on that, but yes, it is a significant amount of money. And so the goal here is to really support and ensure resident safety and well-being in our homes. And so this is one of the pieces, I guess, that is in response to some of the pandemic observations in long-term care, as well as going back to Elizabeth Wettlaufer situation. So creating more structure in inspections and assurances for resident safety and well-being would be my general interpretation and comment. But yeah, significant amount of money. Thank you.
Okay, anything additional? Committee Member Hens.
Thank you, Mr. Warden. And on January 8th, you received funding for specialized equipment. And forgive my ignorance, what is a Doppler?
Great question through. Sorry about that. So a Doppler is similar to an ultrasound. So it is a portable device that will support wound therapy and give an indicator that maybe additional investigation might need to be completed to rule out DVT or a clot. So it's really just a very low-level ultrasound opportunity to support our wound care, because some of our wound care needs, we really need to understand the blood flow and the circulation and the subcutaneous tissue before we start doing a treatment.
Thank you.
Anyone else? Catherine, please.
Resolved that the report titled Homes Committee of Management Long-Term Care Director's Update, January 1st to March 31st, 2024, from the Director of Homes and Senior Services, dated June 25th, 2024, be received and filed, and that the Committee of Management authorize staff to sign and submit Schedule F Form of Compliance Declaration for the MSA for the period of April 1st, 2023 to March 31st, 2024, indicating one exception related to training/work plan requirements.
Mover and seconder, please. Committee Member Noble and Committee Member Cookett. All in favor? That is carried. Thank you. 6.2, from the Director of Homes and Senior Services Homes, Committee of Management Policy and Procedure Manuals, Review and Revision. Michelle, please.
Thank you, Mr. Chair, through to you to members of Committee of Management. So the report before you is highlighting departmental policy and procedure manuals and really focusing on ensuring consistency and quality in the services provided by our three homes. So all of the policy manuals are reviewed annually, as well if legislative changes or directives are delivered or communicated to the homes to ensure inclusion of best practice and alignment with current legislation. So all of the homes policy and procedure manuals were reviewed and revised as needed in December, the month of December 2023 was our month of doing policy manuals. And the changes were implemented in early January 2024. They were approved by myself as per the delegation authority bylaw, but certainly worked very closely with all of the departmental managers and teams to ensure that those policies were up to date. Since December, there was a few updates related to our Terrace Lodge project. So we had some new dietary equipment, a change in our linen chutes. So those policies were implemented. As well, looking at the proactive compliance inspection results from Terrace Lodge in regards to quality, I made a number of changes to policies for quality. Those are included here as well. So it seems like a large volume of policy updates, but the majority of the changes are very minor and just minimal, and most do not require education of staff, but those that did, that would be placed on the surge learning and communicated, or doing a special in-service for frontline staff as needed. So all of those, the list of changes are included in those pages. I used to include a link in the report. That's a lot of work on our end for the individual that does that. She has to move all the policies to this special link and then afterwards upload them onto our desktop link. So what I would like to offer, if it's of value, is to have the opportunity to have the IT department put a link on each of your devices so that if you want to review the policies, they're there and available for you. So just wanted to share that. Other than that, the recommendation is before you, and I'm happy to take any questions you may have.
Thank you, Michelle, for that report. Any questions? Okay, again, quite a lengthy list. Catherine, please.
Resolved that the report titled Homes Committee of Management Policy and Procedure Manuals, Review and Revision from the Director of Homes and Senior Services dated June 25th, 2024 be received and filed.
Mover and seconder, Committee Member Jones and Committee Member Jiguer. All in favor? That's carried. Thank you. 6.3, Director of Homes and Senior Services, Homes Committee of Management Long-Term Care Operational Report. Okay, Michelle.
Thank you, Mr. Chair, through you to members of the Committee of Management. So this report provides an overview of our day-to-day operations of our three homes, along with some pertinent departmental and committee updates and the inspections from the period of January 1st to March 31st, 2024. The first area in the report is the Resident and Family Experience Survey from 2023. Again, this would have been information collected in the fall and then received in December and processed in 2024 this year. And so I've got a table that I've got indicators on the left and then listing each of the three homes. You will note that the response rates for the survey are low. And that's despite great efforts of promoting the survey at resident care conferences, at resident council, family council, by email, sending the link electronically and having it available as hard copy. So it's still about less than a third of our population is actually completing the survey. It's completed by residents and families and caregivers. I was really, so I've highlighted some areas, and if there's different information you'd like to see, we can incorporate that moving forward. I've highlighted top 3 areas of satisfaction. I was really pleased to see the indicators of how well staff listen to you and the call bell response team time being positive outcomes there. If you look at the areas for improvement, you will note that across the 3 homes, there's 2 areas that were consistent. One was contracted in-house services, and this was really specific to one of our services, and it's across the province, so I guess I'm safe in saying it's the dental services, because each provider that responds to our request for proposal has a minimum number of residents that they need to see when they come out to the homes. And so there isn't a great need for dental services. So they're usually out 3 or 4 times to each of our homes, and so they'll see the residents. But if there's something that's in between, the family and the resident do need to make accommodations for transportation and to see an offsite dental service provider. So that was an area there that was identified. And then laundry services, again, despite a lot of communication to residents and families that we use commercial machines, we still receive some of those items that are hand wash only and may end up in the wash machine or the dryer. So that was some of that feedback from that particular area. And in the next section, I've highlighted some of the top words and comments used by residents and family to describe the homes, and the list was much longer. I just pulled out a few of those. And so again, this information goes to the resident council, the family council, and the CQI committee, and we work to develop the quality improvement plans. The next area of the report is the Ministry of Long-Term Care Compliance Inspection Visit Report Summary. So just a refresh for this committee, ministry inspections are unannounced. They'll last from 1 day to 2 weeks, and it depends on the purpose of the inspection. And there's 3 types of inspections that we'll see. One is reactive. So also included in this report, you'll see a list of critical incidents that we submitted electronically to the ministry. So some of those critical incidents may result in a reactive inspection at our homes. Similarly, if there's a complaint that we submit electronically, or if somebody calls the ministry hotline to bring a concern forward, the ministry is obligated to come out and to review those. So that's one type of inspection. Those are usually 1 to a few days in length. And then we have proactive inspections, which were introduced by the ministry in 2023. And this is a broad-based inspection. It's carried out on a regular basis. And these are the ones that are 1 to 2 weeks in length. And this is to ensure a home is in ongoing compliance with the Act and the regulations. And then there's other types of inspection, which Terrace Lodge has experienced. That's the pre-occupancy and the post-occupancy inspection as you're doing development and redevelopment projects. So both Beaubeer Villa and Terrace Lodge participated in their first proactive compliance inspection this quarter, and those results are part of this report. So we'll just go quickly through high level through each of the reports. Beaubeer Villa. So I will preface with the ministry utilizes tools to ensure consistency across homes and inspectors, and they're called inspection protocols, and for different categories. So for new admissions, for resident charges, for resident council, family council, skin and wound, falls. So they have a good number of inspection protocols. They utilized 12 of these protocols at Beaubeer Villa for their inspection for March 6th to 15th. There were 3 non-compliance remedied that I've identified in the report. These are areas that, it's a minor and we fix it immediately. And in the past, they haven't been included in the report, but now they're including them in the report as non-compliance remedied. There were also 9 areas of non-compliance whereby a written notification, which is the lowest level of finding that you can receive, was issued. And so I've outlined the areas there, and I did speak earlier to the quality memo that came out by the ministry in February, as a number of homes were having similar findings. And again, it's not that the work wasn't being done, it was that a few of the documentation requirements were missing. So that was that piece. And there was one compliance order related to medication self-administration. When you do receive a compliance order, there's a time frame attached to that. So this report came out in April, and we had just under a month to comply with that order. So the team worked diligently to implement the required pieces of updating policies, doing education, and the education included the physicians and all of the registered staff involved in medications, because physicians also order medications, right? So, we did the education across the 3 homes and involved the 3 homes in the policy updates to ensure consistency across the homes. Some of the other changes as a result of the proactive inspection at Beaubeer Villa is we've increased the frequency of audits, as well as the frequency that managers are doing rounds during the dining period at mealtime. Quite a number of policies were updated, and a lot of education was done. We also introduced a pleasurable dining committee to support mealtime service, to address those areas. Elgin Manor had 1 inspection during this time, and it was related to a critical incident, and there were no findings of noncompliance for that particular inspection. Terrace Lodge had 2 inspections during this time, so they had their first proactive compliance inspection. They utilized 11 inspection protocols there, and there was 1 non-compliance remedied, noted in the report. And there was 8 areas of non-compliance whereby a written notification was issued. And no orders at Terrace Lodge with that one. The management team, and again, the continuous quality improvement team, jumped into action, and we're making the similar implementation audits, and more audits, increased manager presence. The other piece is that the quality improvement tool, I apologize if this is duplicate, but the annual reporting tool that we utilized was a tool recommended by the ministry. It was a Health Quality Ontario tool. And so we utilized their template, and then during our inspection, we're told that it wasn't wholesome enough. There was a couple of minor areas that were missing. So we have moved away from that tool, and we're now utilizing the updated revised template. And so the ministry did send out a memo as well, indicating that if you're going to use that tool, you need to make sure you're ticking all of the other boxes as well. So they were minor in nature, and so that's been addressed. And then there was one other inspection at Terrace Lodge in respect to critical incidents. And there were 3 written notifications issued, post-fall assessment and pain assessment. And so the post-fall assessment, this is a piece where we have majority of our assessments are done online, but there is one called a head injury routine that is a paper-based, because we've struggled to build that one online. And so we're getting back to the drawing board on that one to try and make sure that we get that online, and that provides assurance that the staff aren't going to miss that one. A lot of education and audits, and just looking at opportunities for improvement there. The next area of the report highlights the types of critical incidents on the left-hand side, and the right-hand side, the numbers for all 3 of our homes. So this list includes all of what we have to submit to the ministry for critical incidents, but you'll see some of them are a 0. I did also want to highlight that the abuse and neglect, you'll see a number of 25 there, but the abuse and neglect critical incident reporting includes harm or risk of harm. And so each of our 3 homes are very proud to have memory care resident home areas. Those residents we support with mild to severe cognitive impairment. And sometimes those residents in that environment, despite the interventions that are in place, will exhibit some responsive behaviors that potentially result in risk of harm. Our homes are very diligent in reporting to the ministry. So You'll see that 22 of the 25 submissions for that category were actually related to risk of harm versus otherwise. And we have the support, there's a bit of ministry funding that allows us some PSW hours, RPN hours, and recreation staff hours for a Behavioral Support Ontario initiative. And so these team members have additional training and can work with these new residents or residents as they change with their responsive behaviors to implement some strategies to support their safety and the safety of others in the home. And so that's great work that's being done. And we also, there's an external team, and that's through STEG. And so we have their support as well. So you see homes that do not provide memory care resident home areas typically will have a significantly lower number of critical incidents in this category. So there was also one written complaint which was addressed in that time period. The next area of information in the report is outbreaks. And so this would be a busy season, January to March, for outbreaks, but Beauvilliers Villa went through without any, so that was good news. Elgin Manor had one outbreak and Terrace Lodge had two. We're very much looking forward at Terrace Lodge to the end state of our project where residents, 84 residents will have their own room with their own washroom and 16 with one other, because we've been having, that home typically has higher outbreak rates and statistics related to 4 people sharing a washroom. So we also are fortunate to have funding for infection prevention and control managers in each of our homes, and they do participate in public health hub meetings as well as community practice meetings through our association. And we're fortunate to have our Terrace Lodge Manager of Resident Care chair that community of practice. And so it provides a lot of networking opportunities and support for our homes. Also, Terrace Lodge welcomed Darlene McDonald as our IPAC manager. We had a vacancy there. And so she started at the end of March and she already is certified. So that's good news to support our homes. And she comes to us having worked at Terrace Lodge years ago and returning to the home that she loved. So it's a good news story. And our other 2 homes, the IPAC managers are preparing for writing their certification this fall. And when we experienced the vacancy at Terrace Lodge, we had a lot of conversation on our end. And so we looked at the funding that's available from the ministry, and we developed a contingency plan so that we're sending 4 registered staff and 1 manager from across the 3 homes for some infection prevention control training. So if we do have a vacancy or during vacations, we will have some coverage to support that work that needs to be done. With every ministry inspection, the first inspection that's done, it doesn't matter whether you're an outbreak or not, is an infection prevention and control audit. So the costs of all that training in the backfill of staff are covered under the ministry funding. The next area is occupancy data. And so for homes to get the full funding from the ministry, we do require to maintain 97% occupancy. And so the teams across our homes work very diligently to fill beds as quickly as we can. And I'm pleased to say that for this quarter, all 3 of our homes are above the 97% requirement. Also included in this report, I thought it would be valuable to share some of the other health system partner inspections and connections that we have. So Beauvilliers Villa did receive a public health, food and safety inspection. Those happen regularly throughout the year. On this particular inspection, there was some dust on one of the air intake vents, so that was noted in the report. All 3 homes are doing their regular fire drills on all shifts. Elgin Manor, there was a code silver that was issued during this time frame related to a threat, and a safety plan was developed and implemented with consultation from the appropriate authorities. Elgin Manor also received a public health, food safety inspection, and there were no findings on that report. Terrace Lodge, the fire safety plan was updated as we shift through our project and the building changes and the emergency exits change. So there was an updated fire plan, which was approved by our local fire chief. And part of our pre-occupancy requirements is having public health come out and inspect. So phase 2 did have the new dining rooms, the new serveries, and the new home kitchens. So that public health inspection was completed. And then I've provided some departmental updates for you in the document. Great work in all of our departments, and the staff do a great job in ensuring resident quality and services and just satisfaction. So the dietary, you'll see a lot of themes for Valentine's Day and other opportunities. But worth noting, at Beaubier Villa, they did do a refresh of their dietary schedules in relation to their proactive compliance inspection. So they were looking at continuity and consistency in the cook's schedule. So looking for an opportunity there. Alga Manor welcomed a 5-week food and nutrition management student, so that was of great value. Food committees are held after every resident council meeting. And at the one committee at Alga Manor, the residents said, we'd like to tour the kitchen. So that arrangements were made for that, and they were in sight with their hairnets on, and some of them even wanted to go into the walk-in fridge and freezers and brave that, but they were quite impressed. They wanted to see where their food was prepared. They wanted to see how it came, and they were excited to see, hey, I use that name brand when I cooked at home, right? So it was just a bit of reassurance for the residents. Resident and Family Council updates. So we do have the requirement to share all of the updates that I've kind of shared with you, including the ministry reports. And, but there's a lot of conversations at Resident Council about activities and what kind of outings are we going to do, and what's the structure of our council. And we had the opportunity to have a guest speaker. Councillor Jaguar was at Terrace Lodge for the Resident Council, speaking about the Comforts of Home campaign. And the outcome of that was that the resident council decided to donate the proceeds of their silent auction to the campaign. So that was a great news story. And certainly anything with masking and visitors, all of that goes to the council. We did some training for them on the solar eclipse, and they get all the vaccine information. Family council highlights are included. I will note here that we generally have fairly active family councils at all 3 of our homes this particular quarter. And so it fluctuates because of the residents that come and go through our homes and families' ability to participate. So we haven't had the on-site meetings, but the information is being communicated to the family council members, which is a very small number, just to make sure they have that information electronically. And a lot of recruitment activity going on, so the ministry has been fine with that approach. Program and therapy highlights, so a lot of new programming opportunities are included in this report, and the recreation department does do a lot of food related programs, so they did a refresh on their food handlers training and safety program. And volunteers is a big piece of the program and therapy. And you'll recall during COVID, we weren't allowed to have visitors, let alone volunteers in the homes. So we did lose a lot of our volunteers. So it's been a process rebuilding that volunteer clientele. So you'll see the numbers are really improving in the report there. We're really excited. And so they've received some retraining, and the 2 managers of program therapy have been involved in the supporting the updated website for the homes as well. Some highlights for nursing department. Again, I've spoke about the pharmacy, which is successful, and the mobile imaging. One of the homes is doing some initial coaching concepts for new hires. All of the homes are looking at increasing their frequency of huddles to promote communication and decision-making, and talking about opportunities for challenge or for addressing some of the challenges they're experiencing. Highlighted some of the education and the nursing departments. And the administrative department updates, again, staff schedule care. The administrative clerk's very pleased with the program. It's allowing them to get to some of the duties that they haven't been able to previously. I've spoken about Clinical Connect there, and we had a couple of vacancies in the administrative department that were temp part-time, and we typically would struggle to fill those positions, but we had some interest from SEIU members recently. And so we were able to successfully work through a letter of understanding with SEIU to allow an opportunity to do some administrative clerk, not in the same home, but in a different home, just to kind of support those needs. And education, myself and the administrators look for opportunities through Advantage Ontario and ministry webinars. And so there's a little note about that. And being that report is till March 31st, it states that the phase 2 is near completion, but you're now well aware that we've moved into phase 2. And so that concludes my report. There is one recommendation that Catherine will read. I'm happy to answer any questions you may have. And I'd also be interested in receiving some feedback on the format of the reports submitted for today, and anything you'd like to see, or am I providing you with too much information, not enough information? Thank you.
Well, thank you very much for that report, Michelle. And that's an interesting question to ask. I'm not so sure there is such a thing as too much information. It's what we do with it. That's more important. So I'm going to turn it over to the committee. Does anyone have questions for Michelle on this operations report? You've covered a lot of territory. Okay. Yes, Committee Member Jones.
Thank you, Chair. Just a comment, I don't think you can have too much information. I think due diligence requires us to see the big picture, and I think we got it.
Okay, thank you for that. Anyone else? Yes, Committee Member Jiguer.
Thank you, Mr. Chair. Yeah, I agree because of our duty as a committee. Perhaps a suggestion could be, since our duty is to manage risk,
Mhm.
there could be maybe an executive summary that has a bit of a dashboard in terms of, is there any risk, whether it's from a
Right.
staffing perspective or funding or just a high level. So then we can drill down. That might help us fulfill our responsibility.
It would certainly ease it for sure. Yes, rather than trying to parse through it, but yeah. Okay. Yes, Committee Member Hens.
Thank you, Chairman. I get a lot of questions about occupants in our long-term care homes. So help me understand, when you have an opening or a vacancy in one of our homes, someone has a list of potential occupants. Could you help me understand how those vacancies are filled, where they come from? And the concern is the citizens of Elgin County, through taxation, pay for the homes. But not all citizens of Elgin County get priority treatment. So please, Michelle.
Thank you for that great question, and through Mr. Chair to yourself, Councillor Huntz. Great question, and this question has come up many times since I've been in this role, and I know, or I believe there was some advocacy by members of council previously with through AMO delegation in regards to this matter. It is something that does come to the table at our association as well, as far as priority status for residents of municipal areas. Unfortunately, that is not the current process. So it is more province-wide. And so the process, we don't make the decision at the homes level. So when we have an open bed, we do notify Home and Community Care Support Services, and they have the lists. So we don't have the list, although we have access to it. But anytime you open the list, it's going to look different than the last time you looked at the list. It's based on crisis. So, you know, residents that are living independently without any type of support, and the level of risk that they have. Might they wander away from home? Might they leave the stove on? So those individuals would be higher. There's also spousal reunification. So if my husband was in the home, I would be a little higher priority status to be able to be placed with my spouse. And then it goes through bed rates as well. So we give that, we say to home and community care support services. We have a bed available, private, semi-private, basic, male, female. They let us know the individual that we should contact, and we contact to make the bed offer. So that's the current process, but I do hear and understand your concern from a local perspective.
Okay, anyone else? Again, it's been a lot of information communicated in a relatively short order. Okay, Catherine, please.
Resolved that the report titled Homes Committee of Management Long-Term Care Operational Report from the Director of Homes and Senior Services dated June 25th, 2024, be received and filed.
Mover and seconder, please. Committee Member Latham, Committee Member Widner. All in favor? And that's carried. We have no other business or correspondence, no closed meetings. Do we have a date established for the next meeting?
Mr. Warden, through you to Michelle, for the next meeting, had you indicated the August 13th council date would be the best date for the next meeting?
All right. Now we know approximately when. It'll be on the 13th. All right, that brings us to the adjournment.
Resolved that we do now adjourn at 11:49 a.m. to meet again on August 13th following the county council meeting.
Do we have a mover and seconder? Committee Member Jones, Committee Member Widner, all in favor? And that is carried. Thank you, everyone. Again, this is a new process for us and a lot of information, and it's only going to get better. So thank you for joining us, and have a great